And a very warm welcome to the programme from me, David Foster. Now, who is to say what is right and what is wrong in these very strange coronavirus times? What is clear, though, is that the longer any lockdowns last, the more jobs will be lost. You may be healthy, but hurt. When is it the right time to loosen the shackles? This is Roundtable. Different countries, different rules. But what is clear is that each government, wherever it happens to be, is wrestling with when to ease any lockdowns. What rules apply? Has anybody got the correct approach?
While social distancing and lockdowns are helping to slow down the spread of the coronavirus outbreak, they have left millions without work, and we are now heading towards an economic catastrophe. Experts say multiple countries are in a recession, and eventually the world will follow. An official estimate for the UK suggested a possible 35% fall in GDP in just a few months, the biggest for a century. A senior official in the US expects a 30% unemployment rate and a 50% drop in US GDP by summer. Countries where the spread of the virus has been brought under control have already begun to lift restrictions in the hope of easing the financial pain. The economic damage that could be caused by an extended lockdown is also a threat to livelihoods and well-being. But researchers say that the danger of a second wave of COVID-19 is very real. So how should governments balance health and wealth when lifting these restrictions?
Well, let's first of all introduce a couple of guests we'll have on later in the programme. That is Andrea Rinaldo, scientist who's been modelling the spread of the virus in Italy, and Tobias Kurth, a professor of public health in Germany. But first, let's talk to Azeem Majeed, a professor of primary care at Imperial College London, and Robert Dingwall, a professor of sociology at Nottingham, Trent University. Great to have you both with us. Azeem, let me ask you first of all, you are a family doctor as well as working in a main hospital, and one of your jobs is to look after the health of doctors, of physicians themselves. Are you worried particularly that if the lockdown is lifted wrongly, they will be even more in the firing line?
Yes, that's a good question, David, and it's a good point. So I'm concerned that if lockdown is lifted too soon, before the infection rate comes down and before we have good ability to test and track people with infection, that we might then see a second wave. So it's very important that in this current lockdown, we do really suppress the infection to a low level and get in place a very good testing system and a very good contact tracing system.
Are you concerned that any second wave, and there could potentially be a third wave, could be more damaging? I'm giving the instance of 1918 Spanish flu, when it's thought that the second wave was much more dangerous because the virus had perhaps mutated.
Yes, that's again a good question. I think thus far there's no great evidence that the virus has mutated, but there is a risk that we might see a big second wave if we release the lockdown too quickly and people start to mingle and spread the infection amongst themselves. The positive news is that countries like South Korea and New Zealand have suppressed the infection very well without really seeing any second wave. So there are examples globally of countries that have done very well that we can really try to emulate to ensure that we don't see a second wave here in the UK or in other countries.
Okay, let's talk about track and trace. The UK government trialling it out at the moment on the Isle of Wight, small island off the south coast. But the concern, or one of the concerns, is that it does not fit internationally. It may work locally, and there are concerns about privacy, but it doesn't fit in with the global track and trace apps that are out there. Is that a problem?
I think the UK government has gone down its own route. It's not gone down the route recommended by companies like Apple and Google. So we need to make sure the app they produce is safe, it keeps your data confidential, and works well. I think the point to note is the app does not replace standard contact tracing, which relies heavily on telephone interaction with the public and direct contact with the public. So we should see this app as an adjunct and an add-on rather than replacing the core activities of contact tracing, which remain through personal contact either via telephone or or in person by a contact tracer.
Let me quote the head of the World Health Organization, Dr. Ghebreyesus, who said, "We want to re-emphasize that easing restrictions is not the end of the epidemic in any country. So-called lockdowns can help to take the heat out of a country's epidemic, but they cannot end it alone. Countries must now ensure that they can detect, test, isolate, and care for every case and trace every contact." That is a number one priority in your view, Azeem?
Yeah, I think that's excellent advice. So when the lockdown is lifted, we must have the capacity to test everyone who has a possible COVID-19 infection. We must be able to trace all their contacts, isolate them, test them if that's needed. We need to ensure our health service has full capacity to deal with any people with serious complications of COVID-19 infection. And we need to ensure that healthcare staff and staff in nursing homes have adequate equipment to protect them from infection. So those are all essential things that must be in place before the lockdown is lifted.
And let's move to Robert. Back with you in a little while, Azeem. We move to you, Robert. In terms of the technical side of this, yes, obviously you've got to get it right, but more than that, socially, you've got to bring the public with you. There must be some kind of conversation, if you like, between the government and the public about this. They've got to be on side.
Well, indeed, I think one of the major problems that the UK government and indeed other governments have at the moment is managing the level of fear and anxiety that has been aroused in the population by some of the initial control measures. And that, I think, is perhaps an even bigger challenge than some of the organizational and institutional challenges that governments already had to face. What's the point of releasing the lockdown if you like the government gives a party and the people refuse to come? I think that getting that public engagement with the process is a big challenge. It's going to require some quite different messaging.
Yeah, it sounds like a great idea to get the public on side. How do you do it?
Well, I think that you could have a great deal more effort by government to release the secrecy of the planning process. What I'm really quite anxious about is the idea that you can cook up a strategy for releasing lockdown behind closed doors in government and then just have a press conference one day and announce it and expect everybody to get into line. I think there's a much better strategy, which is in terms of thinking, well, this is what we have in mind. What ideas do the public have? How can they improve it? How can we actually have a conversation about this? Which I think is very much what Nicola Sturgeon's been trying to do in Scotland.
It's a great idea to get the public on side and get their opinions, but all of that takes time, too much time perhaps.
Well, not necessarily if one's thinking about a strategy for lockdown for releasing lockdown rather that might extend over several months. It might be better to spend another week or so at the beginning and get it right rather than rush things and then be floundering around trying to think about how do we dig ourselves out of the hole rather than digging ourselves deeper into it.
From the point of view of the damage that a lockdown has done, has it been worthwhile in your opinion?
Well, I think that we have lost something of a sense of proportion with the sort of obsessive focus on the story about deaths. Obviously every death is a human tragedy. It's a loss to a family, to friends, to a neighborhood, to workmates. But we should remember that 80% of the people who contract this virus do not need to go to hospital. They get better on their own. And of those who do go to hospital, almost all of them come out alive. Now, some of them will need a lengthy period of rehabilitation, especially if they've been in intensive care. But I think that in looking at this, in looking at how we manage this, we've got to have some greater degree of proportionality between the very small risk of death, the slightly larger risk of some serious event that requires intervention by the healthcare system, and the fact that most people will get better without any intervention on anybody else's part.
It's almost damned if you do and damned if you don't, and you've got to have the wisdom of Solomon in this. Azeem, let me come back to you. One of the jobs that you do is to consult, inform at a national and a local level, presumably about what the next best step is going to be. What sort of advice do you think you'd like to give on this programme?
I think the advice is that the lockdown needs to be used to really suppress the infection. As Robert mentioned, it has got negative effects as well on the population and also very serious effects on the economy. So I think we need to maximise the lockdown period to really control the infection, put in place excellent testing programs, excellent contact tracing programs, so we can really suppress the infection as has been done in South Korea and New Zealand, and allow our society to return to some kind of normality in the coming weeks and months, so people can start to lead more
It probably
lives.
won't be the same as it was before at any time in the next couple of years. But when do you expect people, Azeem first and then to you, Robert, when do you expect people to be able to think, actually, life is pretty much as I would like it to be?
I think it's going to be some time before that happens. So although the lockdown may be released in late May or early June, it'll be a partial release, not a full release. And many events that we've been used to, like large sporting events with large crowds, concerts, etc., those kind of things probably won't occur in that format for a long time to come. So we will have a more normal life, but as you said, it'll be a long time before we fully return to normal, and that really depends on really suppressing the infection to no levels or getting a vaccine to protect the population from COVID-19, which is probably some time away yet. So I think we'll have a more normal life, but not a fully normal life as we had a few months ago for quite a long time.
Should we be worried about a second wave?
We should worry, but at the same time, we can suppress a second wave through testing, isolation of cases and contacts, contact tracing. We can suppress a second wave, so we should be vigilant, but not unduly anxious. We need to make sure that we do not experience a second wave. So vigilant, but not over anxious about that.
Robert, you seem sceptical about what benefits the lockdown has had. If there is a massive spike in death, second wave, perhaps a third wave, would you reconsider your thoughts on this?
Well, yes, but I'm rather sceptical about the assumption that there will be a second wave simply because there were 3 waves of the pandemic influenza in 1918. This is a quite different virus. It's clearly a lot more stable. The coronaviruses don't seem to mutate in the way that the influenza viruses do. And I'm also inclined to think that the rather slow pace of release from lockdown that the UK seems likely to embark on is going to give us an opportunity to observe the experience of other European countries which have perhaps had more intense lockdowns, but which are risking much more of a bounce back as they're released. It may simply be that we slow the pace of release rather than trying to get into the sort of boom and bust cycle that I think some European countries may find that they're trapped in.
Well, listen, gentlemen, thank you both very much indeed. Robert, interesting that you should mention the approach of other countries. That is where we are going to go in the next part of this programme. But for now, from me to you, thanks for taking part in the programme. Well, I did say that in the second part of this roundtable, we would be going intercontinental. So let's welcome from Padua in Italy, a hotbed, Italy, of course, for coronavirus, Andrea Rinaldo, professor with over a decade's experience in epidemic modelling. And we move to Berlin to welcome Tobias Kurth, a professor of public health and epidemiology. I'm going to come to you first, Tobias, if I may, because Germany has recently lifted, certainly in parts, the lockdown. How's it going?
I think overall Germany is doing very well, and we're slowly moving on to lift the lockdown, as I just mentioned. So opening the shops, some shops, and now most of the shops. As of yesterday, some of the school kids could go back to work, and the politicians as well as the scientists discussing how to proceed with this slow opening of the lockdown. So overall, the numbers are stable, and I think it's going quite well.
We talked earlier in the programme, you may be aware of it or not, but it doesn't really matter, about a possible second wave, fears of a second wave. Is that a concern in Germany?
Of course, there is a concern of a so-called second wave. What we have to understand is that the virus is not gone. It's likely going to be with us for the next years to come. And there's always a risk that a increase in the new infections is observable. And that's what people refer to as a second wave. So yes, it's a possibility, and we're carefully watching the numbers to prevent that the healthcare system is collapsing, such as in some regions in Europe, and look very carefully to not make this happen. So yes, a second wave is possible, maybe a third or even a fourth wave.
We talked also earlier in the programme about the UK's track and trace app that may be coming in soon. It's being given a run out in a small part of the country at the moment. How does that work in Germany?
Well, there's still a discussion about this tracing app. I think overall, theoretically, it's a good idea. Now, obviously, as is voluntarily, everybody should use it. And the more people using it, the better it will be to really trace a potential cluster or a potential area where you have many people who are infected. We have to see whether it's actually working. Technically, I'm sure it's doable. The question is just, are people using it? Are people not afraid of sharing their data or being afraid that there will be traced in a way that is problematic for them? So there's quite some skepticism, but overall, I think the idea is good, and I hope that many will use it so we can identify clusters earlier and then take preventative measures.
Okay, back with you in just a little bit, Tobias, but let's go to Andrea Rinaldo, who's in Padua. You've prepared some graphic pictures of what is happening in Italy at the moment and what might happen if the lockdown is lifted. First of all, there's a blue line at the bottom, which is what the situation is at the moment, staying it's fairly steady after the disastrous start. Then the green line above, that is if there were a 10% increase, either in infections or hospital cases, you'll tell me, and the red is 20%. And you can see that both of those go up very, very steadily. So Italy is going to be extremely careful about what it does with lifting the lockdown?
Well, I would see the proof is in the pudding because the regulations are there. It depends on the degree of discipline that my fellow citizens will show, in fact, in adhering to personal protection, for instance, social distancing, and then all the kind of information will be able to gather. It seems to me that it was time to lift the lockdown because no matter what, we have all the evidence we have, either from serological evidence or modeling evidence, is that after this huge wave of infections, still from 95 to 98% of the country is susceptible to the disease. That means that in reality, the catastrophe could still happen because I've been locked down. I'm still susceptible. I'm still well, okay. But if I go out and the virus stays there, which is highly likely, if not near certain, I may catch the disease. So if we waited more before lifting lockdowns, probably if we waited more, we could have been get into a more manageable state. But it was about time to try to gain speed with the economy, balancing costs and benefits.
But different parts of Italy, according to you, and we're not going to see these graphics, but you can explain it, different parts of Italy will fare differently when the lockdown is lifted. Why is that?
Well, part of that means it has to do with the structure of the sanitary infrastructure throughout the country, which is rather unevenly distributed. What is ironic is that it is the most developed part, another part, Lombardy and my region, Veneto, that was hit the most. So it's a good combination of chance and necessity, I think, because it depends on where the infection was seeded first and how people reacted. So the point is not, of course, we have to lift the lockdown, I think. We have to have the benefits gaining speed. But the cost very much depend on mitigation measures that we might be able to take to bring the epidemic under control.
And different areas reacting in different ways. Do you think that's peculiar to Italy, or would that be the same case in most European countries, do you think?
I'm not sure about the other countries, but I can tell you that in certain metropolitan areas of like 500,000 people, in parts of Italy, which I have not mentioned, you have like 15 beds in intensive care units. You can have 15 people attached to a respirator. And that means that what the lockdown produced for sure was avoiding the collapse of the Italian national health system so far. So that doesn't mean that we have avoided a much higher second wave, but it meant that it was it operated fairly well in avoiding this disaster and, of course, unnecessary death. Now, what kind of mitigation measures remains to be seen. There are different ways you could do that. We have tools to see ahead of time by assimilating data and filtering the information properly to see what the bulk effect of a combination of the lifting of the regulations and how people abide to the regulations.
Tobias, let me ask you, what lessons do you think Germany has learned from the way it handled the pandemic to start with, and what led to lifting of the lockdown restrictions?
Well, I think we all learn every day, and Germany got in a way lucky that we saw what happened in other parts of the world, and particularly in Europe and in Italy. And so we were somewhat prepared to react, to identify the first cases, isolate them, and then prepare the healthcare system in addition to what we already had. And I think now what we're learning through the lockdown and the pandemic is that we have to move on. And we know that the virus will not go away. So we have to start as a society to really find a way to live with the virus, to not live in lockdown for the next 5 years, and to have a certain discipline, hygiene discipline, to really avoid personal contact as much as possible in public. And so I think there's a learning curve. Obviously, there's also a learning curve in communication, how you communicate with the people, how you tell them what's going on, how you tell them what they can do, and how you bring them into the decision process, that they're not felt well, the politicians decide what to do, and then they decide another thing. So I think we have to move on.
And that worked quite well in Germany, did it? Because it was a question raised in part one of this program that we need to engage the UK public, and I suggested it might take too long. How did that go?
I think for the communication, it's really to identify the risk. In Germany, we did identify the risk very early. There was a good communication between scientists and the politicians reacted accordingly. And I think that was the key. And we're learning how to deal with the crisis and move on with it. I think that's a key message.
Let me quote this to you. Dominic Raab, the British Foreign Secretary, telling a Number 10 press conference a few days ago, having relaxed restrictions in Germany over the past week, they've seen a rise in the transmission rate of coronavirus. Is that a big, big fear?
Well, the rate is not rising. The rate is stabilizing over quite some weeks. It's going down, and I think we follow in Germany very closely what is going on in Germany and in other countries, and adapt what we do and adapt the healthcare system accordingly. So that's the important key, to really connect the pieces and then really discuss this in detail and react.
Andrea, Italy's mistakes at the beginning of this, the massive death rate, what has been learned, and what will happen with the lockdown?
Okay, now on two different separate, say, planes. One is what have we learned about the pandemic? In my view, is how fragile the fragility about the globalized society, of course, because of course pandemics happened in the past, but what required the cranking of centuries or tens of years now is done in a matter of weeks. And it also shows, and that's what my background shows in my hometown of Venice, is that the resilience of an ecosystem is in fact part of its diversity. The economy of my hometown relies almost entirely on tourism. And see what happens. We've never seen the Grand Canal this flat. So globalized society are fragile, and it's a lesson that will be a lasting one. What I have learned in Italy is that, of course, in my country, my beloved country, discipline and civic education is not one of the most characteristic features. And what is totally surprising to me is how, in fact, Italians reacted and obeyed the law and abide by the law, which is truly remarkable. And that was immediate, in fact, because the correlation between the lockdown and the decrease in the reported cases, whether hospitalizations or deaths, etc., was very clear, in fact.
But will patience run out?
Of course, because now, as I was saying, is that now the issue is that you cannot. There are even interesting popular songs on how you might die waiting to some restrictions to be left in cholera times in Rome, for instance, vernacular poets. What you have is that now you have to have the economy picking up, and you have to cope with it, because no matter what we are talking about, on average, 97% of the Italians are still susceptible to the disease. So the disease is there to stay if the virus stays there. So herd immunity is far, far, far away. What we have to do is just release progressively and find mitigation structure. One is, of course, aggressive testing, aggressive tracing, as Tobias was saying before. And the other thing is that maybe in that case, theory can help in finding out the amount of case isolations which is necessary to bring the epidemics under control, even though you release lockdown.
Okay, listen, thank you very much indeed, Andrea Rinaldo, Tobias Kurth. And Andrea, I must say to you that even if, sadly, the tourist numbers in Venice are down, at least now the Blue Lagoon is blue again, which is a wonderful thing. Thank you very much indeed for joining us on this edition of Roundtable, and thank you very much for watching. From me, David Foster, from the team that put it together, we thank you for being in our company. We will see you next time, we hope. For now, stay home, stay safe, and if you can, stay with us. Goodbye.